Okay, great. Welcome. Thank you for joining us today. I'm Dr. Diana Chavkin from HRC in West Los Angeles. Today I have with me Brittany from ELANZA Wellness, who wrote an amazing book called Everything Egg Freezing. And in her book, she talks a bit about nutrition. And so I brought her here today to help me talk about nutrition, specifically about nutrition during a cycle, during stimulation for either IVF or egg freezing. So thank you for joining me here today. So there's a lot to talk about when we talk about nutrition. People are always thinking about, what should I eat? What is the best way for me to stay healthy, to prepare for my cycle or after my cycle, or in general to keep my fertility healthy and my body healthy. And there's really, there's so much to talk about. And so we just wanted to focus today specifically on things that you can do while you are taking your medication, taking your stimulation medications, your injections for either an IVF or an egg freezing cycle. So Brittany, share with us your wisdom, and I'll chime in along the way.
Well, I think for everyone it's a little bit different. Some people feel more impacted by the medications than others. At that point in your sort of egg maturation journey, let's call it, things are pretty much set in stone. You can't have that much of an impact on your egg quality. However, there's a lot you can do to at least kind of have a better cycle in general. So I don't know, I get asked all the time, and I'm sure you do as well, things like caffeine and alcohol. Mm-hmm. So, caffeine in general is a stimulant. So anything that sort of tends to, if you drink it in excess, it can obviously sort of have a negative effect. Some people obviously respond more strongly than others. So I often tell people to just reduce the amount of caffeine in their day. But if it's more stressful for you to take it out entirely, then, we're not trying to rock the boat at this point. So, right. Often it's nice to just maybe switch to something like green tea, which has less of a sort of jittery effect. Mm-hmm. Maybe you have thoughts on caffeine.
Yeah, a lot of thoughts about caffeine. The one thing also just to keep in mind is, a lot of times people think about caffeine and they think about the association with pregnancy right away. Even though they're just doing an egg freezing or an IVF cycle, the recommendation from ACOG is to limit your caffeine intake to 1 cup a day. And that actually pretty significantly less than I think a lot of women are actually taking, especially if they're in the workforce. They're probably taking more than that. So when they're pregnant, we say 1 cup a day. There is no clear recommendation for what to do when someone is doing an IVF or an egg freezing cycle, but I think you're right. Maybe starting to think about, okay, what would I do if I were pregnant? Maybe thinking about 1 cup a day and decreasing it to that amount would be a good thing to do. But if you're having 4 or 5 cups a day, maybe 2 or 3 cups is good for you if that's lessening it for you. And like you said, if it's stressful to just take it out or reduce it at this point, really it should not have an impact on your outcome, especially if we're talking about you not getting pregnant right now. Like if we're just talking about doing an IVF or an egg freezing cycle, the impact of caffeine on your eggs or on your amount of eggs that we'll get, or the quality of the eggs, is really not going to be impacted in that way. The one thing about caffeine is that some other things about caffeine is, yes, it does make you kind of jittery. And I do know from some people, when they take the injections, the hormonal medications, they sometimes can feel a little bit, not usually, but some people do feel a little bit edgy. I have a good friend who kind of was telling me she couldn't sleep. She just felt so alert from the medications. And that's not a usual side effect, but some people do feel that. And so if you are someone that feels that way, caffeine could obviously exacerbate that. So that's something to look out for and pay attention to. And some people interpret that as anxiety, and potentially it could be a little bit, but I think it also really could be an effect of the medication. And again, all of that, the emotional, the anxiety, the hormonal effect of potentially making you a little jittery, and then on top of that, the caffeine can really be a little bit too much for people. So lessening the caffeine can help in that way. Also, caffeine can be very dehydrating.
Right.
We really don't want people to get dehydrated during this process. It's important to stay well hydrated, if anything, right? We talk about drinking, things like coconut water and Gatorade, things that have, good amount of electrolytes and are very hydrating. And so we don't want to make you less hydrated by drinking caffeine. Again, you don't want to, wreak havoc to your world. And if you're dependent on caffeine, you that's okay. But just things to keep in mind. And maybe you want to drink a little extra water if you're drinking some caffeine. So that's what I would say about caffeine.
Yeah, and it's a little bit similar with alcohol as well. I don't think, again, to your point, the research is really limited. However, one, glass of wine or something is not going to make or break your outcome. However, again, going with the idea that you're taking hormonal medications, you just don't know how you're going to be feeling. This is usually sort of a unique time for people in their lives anyway without the medication. So just kind of realizing that the impact the alcohol might have on your mental state, your emotional kind of fluctuations, and again, kind of limiting it to maybe one glass, if you need to a day. But then again, it's more like if it's going to be more stressful for you to take it out entirely, then that should be fine. However, I think that most people would say it'd be great if you just eliminated it for that entire time, for the sort of confounding factors such as dehydration and, can spike blood sugar, things like that, which can dysregulate your hormones just in general. So yeah, I think that alcohol and coffee kind of go in that, like, it would be great if you could eliminate it, but if it's going to be so stressful and sort of difficult for you to kind of change your daily routine, then one glass or cup is probably okay.
I agree. I totally agree with that. And there are a lot of similarities to caffeine and alcohol. So for alcohol, we generally say when you're pregnant, you don't want to have any alcohol. There is no known safe amount of alcohol during pregnancy, and that's an ACOG recommendation. But during an IVF cycle or an egg freezing cycle, you're not pregnant. So it's not the same restriction as it is for when you're pregnant. So when you're pregnant, no alcohol at all. During an IVF or an egg freezing cycle, it is really probably okay to have a glass of wine here and there. It really is. I generally tell people, listen, you don't want to start drinking now, right? It's not the time to start. But if you really have wine with dinner every night, and all of a sudden not to have any wine is going to really shake up your life, it probably is okay a little bit here and there. I just never want people to look back and say, oh, if only I changed that, maybe I'd have a different outcome. So I generally say, yeah, if you can live without it, probably best to stay away from it. The other two things is that, so first of all, alcohol can make you drowsy, right? That's an obvious thing. And these medications, for some women, they get actually pretty, as I mentioned, sometimes people get a little bit, hyped up when they take the medication. Sometimes people can actually feel drowsy. And so if you're somebody who feels drowsy and a little bit like lethargic and tired while you're taking your stimulation medications, and then on top of it, you're drinking alcohol, which is making you more lethargic and tired, probably not a good combination. So I think it's also important to pay attention to how you feel, and also realize that things that you're feeling may not just be in your head. They may actually be real effects from the chemicals that you're putting into your body.
I felt so lethargic. I don't know how. I'm so jealous of the people who are energetic. That's awesome.
I definitely, yes, I've had good friends who've been through it, and I'm like, I can't sleep, I'm so energetic. And yes, I definitely have people who are absolutely lethargic from the medication.
Yeah, one thing that I also found, so I have PCOS, and it also puts me at higher risk for OHSS, which is ovarian hyperstimulation syndrome. And that basically, it's so, I'm sure you can speak to this, it's the chances of that happening are really low nowadays with the protocol. However, yeah, it's one of those things where I personally had quite a few eggs, and my ovaries were hyper expanded, and I was just so bloated, and I couldn't, it was just extremely difficult to kind of, it was very uncomfortable for me right in the end there. And so for me, having to cut down on salt, which is a real weakness for me, so really sort of eliminating salty foods that would kind of help you or make you retain water more. Anything that made you constipated was just really uncomfortable. So, focusing on, again, hydration, having lots of, whether it's coconut water, regular water, just kind of making sure to not just flush your body of the hormones in the proper amounts, but also just ensuring that you don't get constipated or, that water retention that is caused by salt.
Yeah, and just to clarify, just in case people don't know, right? So the risk of ovarian hyperstimulation syndrome and the risk of dehydration, so all that, it really does come hand in hand, because when we say that somebody is hydrated and they're not hyperstimulated, what we're talking about is that the fluid is staying in their blood vessels. So the concern with ovarian hyperstimulation syndrome and dehydration hand in hand is when the fluid essentially can leak out of your blood vessels and kind of third space and kind of make you bloated. So your blood vessels, your blood is not maintaining the actual fluid, is not maintaining the water. It's kind of leaking out. And so that makes you kind of we call it third spacing, but it makes you bloated, makes you swollen, but you're not actually hydrated. So that's what we're talking about when we talk about staying away from salt. Salt could cause a problem where you're not able to keep the fluid into your blood vessels as well as you should. But also coffee and alcohol also do that, where your blood vessels are kind of drains of the fluid, and then hyperstimulation on top of that causes an issue where you're leaking the water from your blood vessels. So all of that is making the situation worse. And so that's why there's a good reason to stay away from salty foods and alcohol and caffeine. And also the fluid issue comes part and parcel with constipation. So when you're dehydrated and you don't have enough fluid in your blood vessels, that impacts constipation as well. So for all those reasons, yes, you want to eat plenty of fiber, stay super hydrated, stay away from salt, coffee, alcohol, all that stuff.
And that probably will benefit you even after the retrieval. Just from a comfort standpoint, I definitely felt really bloated at the end there. So having, maintaining that sort of nutritional protocol is probably pretty good for your emotional and physical state. But yeah, also for just the outcome preceding the retrieval.
Absolutely. Absolutely. Well, great. Well, thank you. I can't believe time is up already. It goes so quickly. Thank you all for tuning in today. This will be posted on Facebook, so you can check it out anytime. And our contact information will be written below. Please feel free to reach out to us. And thank you so much, Brittany, for joining me today. And thank you all at home. I wish you a wonderful day. Take care.
Thanks so much.
Thank you.